Hi, my name is Doug Wine, and in the fall of 2018, I went to Dr. Pundit's office. I'm 53 years old, and for about 50 years of my life, I've always had sinus problems. Basically, I assumed that when the winter came, I would have sinus infections 2, 3, 4 times. When I moved to Dallas in 2017, I was told it's the third worst place for allergies in the country, and so I should just assume that I won't be able to breathe well. And I went to, again, I had a series of sinus infections, couldn't breathe. I would go to sleep at night. I would wake up at least twice because I was unable to breathe through my nose, and I breathed so much through my mouth that my mouth was dry and everything was swollen. And so then I had to sort of like get my tongue moist enough so that it wasn't swollen, then I could go back to sleep. Doctor said what he was going to do was sort of widen these areas up here in my nostrils, and then he noticed I had a growth down at the back of my throat. And he said, I think that really might help you. And I honestly didn't think anything of it, but I figured a growth in the back of my throat wasn't really a good thing. My wife and I had a friend of ours who had had a similar surgery with a problem in the back of the throat. He had had black eyes for days, so I thought going in, all right, I'll go for it, but who knows. Had the surgery, went in first thing in the morning, and by noon I was actually ready to eat. Didn't have to take any pain medication, and within 2 or 3 days, I had it on a Friday, I was back to work Monday, no issues whatsoever. And I have not had a cold or a sinus infection since. And so the reason I'm doing this is a testimonial to the work that Dr. Pundit did. The surgery was nothing. It was actually the first surgery I ever had, and I've since moved out of Dallas. I'm living in Massachusetts, where right now it's pretty cold. We've already had 2 snowstorms, and again, no sinus infections, no colds. Have had to sneeze, and I actually can drain normally down the back of my throat, and I just want to say that he did a phenomenal job, and I think it would be worth your while if he tells you to do any sort of surgery like that to do so. Thank you.